Welcome to the COPD Foundation podcast. We bring you insights from leading health professionals, inspiring stories from those living with lung conditions, practical advice, and the latest in lung health research. Be sure to subscribe, follow us on social media, and visit copdfoundation.org. Take action today, breathe better tomorrow. Just a quick note before we jump into our topic. This podcast series was created for educational purposes only and is not a substitute for formal medical advice. Talk to your healthcare provider if you have any questions.
Hello, and welcome to this episode of the COPD Foundation podcast. I'm your host, Johnny Karenko, a respiratory therapist and educator here at the COPD Foundation. You're just in time for a special discussion on communication barriers and their effect on managing COPD. We're joined by two special guests today, Tracy Fasolino, a nurse practitioner who's going to share insights on how effective communication can improve outcomes for people living with COPD, and Lisa Hall, who will provide a personal perspective on living with and managing COPD. Together, we'll explore the importance of clear communication in preventing worsening COPD and how healthcare teams and patients can bridge these gaps together. Let's dive in.
My name's Tracy Fasolino. I am a nurse practitioner that works in upstate South Carolina in a pulmonary practice, and I've been there for about 12 years now. And I also have another job. I'm a professor at Clemson University in the School of Nursing, and I have an opportunity to teach next generation nurse practitioners, nurses, and I really do enjoy that aspect of it too. I grew up in Appalachia, lived in Appalachia all my life, so I know how to grow maybe a wicked cucumber or a fun-looking tomato. But I don't know much about the big city kind of things, so I keep it kind of real in the countryside, and in that space, it's a lot of fun to work with people and understand what they bring to the table and what I bring to the table. So right now I'm in DC. I have a fellowship working in the health and aging policy space. So I've been here a couple months now, and it is kind of a weird setting for me to be in a big city. But I'm learning a lot about communication, which is a critical part when it comes to health policy. So I'm looking forward to sharing my thoughts with you on some of the questions that you are asking me.
My name is Lisa. I live in a very tiny northwestern Minnesota town. I have COPD. I have had it since I was for about 7, 8 years now. I grew up having asthma my whole life, which is now turned into COPD. I have 2 children and 4 grandchildren, and my grandchildren are my life. And my daughter and my 2-year-old granddaughter also have asthma. So I would like to spread awareness to make it better for them in the future so they don't have to go through everything that I've gone through.
Lisa, I remember you telling me that you had a situation where you were feeling really bad one day. And by the time you got to your doctor, you were feeling better, and that you felt that experience impacted your communication with your doctor. Can you tell me a little bit more about that?
It could be I can feel really bad one day and feel really good the next day. So trying to let them see what it's like, how I feel on a bad day is a hard situation, and trying to communicate that to them. Yeah, because you can't exactly get into a doctor's just, in a 1-day span. So then you end up in the emergency room. And so that's hard to communicate that to your COPD team.
In your experience, what are some of the most common communication barriers between healthcare providers and some of the COPD patients that you see coming in?
Absolutely. And, I think we have to remember that communication is a two-way street, right? That we have to understand each other. And I was thinking about a few things like the words we speak, right? Like, for example, am I saying something that might be too medical? We all have this, we literally have to translate in our heads back and forth the words that we are saying. So if I want to teach somebody about COPD, am I falling back into those crazy terms like pathophysiology and the language that we use? So I have to really pay attention to flip those terms back into something that the patient can truly grasp and understand. And I think sometimes the way we use words, are we expressing hope? Are we expressing happiness? Are we going to trigger some anger or some frustration? And so I think emotions play a huge part in communication. We might get frustrated with each other because we aren't communicating well. And then we just literally just shut down, right? Then we end up shutting down. And, when I hear someone say, for example, yeah, I have shortness of breath, right? What do I actually hear? What am I taking in there? Am I saying to myself, well, is this patient experiencing shortness of breath all the time? Is it just once in a while? And as a healthcare provider, I think we're responsible for diving in a little deeper and asking those questions like, is it once a week? And in my mind, I was like, well, once a week doesn't sound horrible, but once a week may be absolutely horrible for that patient. So I think that when we have someone that's thinking about clear language with like real honesty, I think that's important too. The other piece I was thinking about was the tone, right? And the pace in which we deliver information. When we are in a meeting and we have maybe 20 minutes, I feel like we do kind of like this huge data dump. And then the patient does that back to us too. They're just like da 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 da, and the speed in which we're delivering the information.
And Lisa, how do you think that the time that you have at your doctor's appointments affects your ability to get the information that you're being told and communicate effectively?
Yes, because it always seems like they're kind of in a rush and ready to just be there because that's their job. And I understand they got lots of patients, but hey, I'm a patient. My insurance is paying big money for me to be here. You're not in this just for the job. You're supposed to be in this to take care of your patients and make sure they're getting the best possible care, not just to rush me in, not listen to my concerns or my questions and just rush me out. Well, and that's a big scare, when your lungs are acting up on any of the COPD conditions, any lung issue, you need to get that care or it's very real that you're going to die. I mean, it's a very real possibility. You got to turn to information that you can be trusted. And I think the first source of that should come from our doctors or even our pharmacists.
In your experience, Tracy, what other factors between the patient and the provider can impact a good working relationship and effective communication?
The other piece is the nonverbal communications, like what is actually being said, but not being said. So I really do pay attention when we're kind of talking about things. Where does the patient's views with their eyes go? Does it lower to the ground? Do they look to their family a little bit with this nonverbal cue of like, oh, I wanted to talk about this or I wanted to share this, but I haven't been able to. So I really do try to pay attention at times to the nonverbal cues. I think the other thing is expectations, right? What does the patient expect from us and what are we expecting from the patient? And the only way to really get to that is to talk about it, right? We probably have different thoughts about it. As a provider, I want to educate the patient. I want them to stay active. I want them to eat healthy. But if the patient's kind of dealing with self-care issues, then I don't think my expectations are the same as theirs. So we really do need to kind of come together on what the clear expectations are, even about who to call, when to call, why to call if we're in trouble, for example, right? Like, I know we use electronic messaging a lot in the electronic health record system. And I will tell you that I don't mind when they send me a note and say, hey, can you refill this medicine or can you get this paperwork done? But when they send me like 5 paragraphs about what's going on, I think, well, then there's something wrong and I need to see you or I need to talk to you instead of trying to answer it. Because I think words don't always relate what's going on. I think it's helpful, but I really do think that we need to consider how much are we trying to give each other back and forth in the electronic world without just having a real conversation. And I know that it's really hard sometimes when you want to be able to reach your provider, but we do need to kind of establish what's the best way. Like that's an expectation. My expectation as a provider is that I would be available to you to answer at least one kind of electronic message if it's something related to a medication. But if we're going back and forth 3 and 4 times in a period of 24 hours or so, I'm like, time out. We need to talk about this face to face so that I'm not losing track of it.
So, how do you think these communication challenges that you kind of mentioned contribute to worsening COPD symptoms or challenges with medication adherence?
Yeah, no, I will tell you that when we don't share that we're having issues like broken equipment or even the inability to buy the medications because of either costs or the donut hole or whatever the issues are, the patient's not getting delivered the care that's needed to maintain the lung health, right? The lung health that we're dealing with. And I know these inhalers are expensive. I have patients who will tell me after I find out they in exacerbation that they had to cut taking their medicine to like every other day or every third day to kind of make it spread out. And I my heart's broken because I want to know ahead of time. I want to know before that gets there so that we can put into place whatever it is that we need to strategize, whether it's the financial backing through some of the pharmaceuticals forms that we can fill out or changing kind of a drug that falls into the formulary. And the drugs are kind of like shifting sands right now. The other thing is just misunderstanding the function of some of these inhalers, right? Like, are you using it correctly? Is it actually your relief inhaler? Is it your maintenance inhaler? And what should you be expecting when you take this medication? And I think that we talk about the interaction of inhalers with some of the other medications. And if they don't I love when the patients bring me the medicines, right? I can't get them to bring them to me, but I love when they do that because then I can really get a full breath of, well, this one is what you're supposed to use. This one is for this, and really helping them understand that a little better. The other thing is recognizing that oxygen is a medicine, right? That oxygen is a medicine and it should be used as prescribed. I have some patients who rely on oxygen all the time, and I'm very, very thankful that we know in the pulmonary world, when you use oxygen as it is prescribed, it can actually make your heart work better. It makes your brain work better. But there are times when patients get tired of it. I wholeheartedly understand that, right? If you need to take a break for a little while, I understand. But then I have to fight with some of them to use the oxygen. And so I think that when we talk about kind of the challenges is we want you to feel better, and we're prescribing things that are geared for that. But if there's an issue with it and you're not using it, then we're finding out once you're in an exacerbation that that's the problem too. And I fear that we have some substantial barriers in our healthcare systems that impact our patients with COPD. And the first one is, who should the patient call when they're in trouble, right? We have our primary care providers who are doing some really great work on trying to get a handle on the COPD. I think the last thing I probably would want to add, just because I work in this space of advanced lung disease, advanced COPD predominantly, is that my specialty is the symptom management part, right? We've got this progressive lung disease, and I know we talk about stage 1, stage 2, stage 3, stage 4, and a lot of patients ask me about that. They're like, what stage am I? And I really do pause and say, let's talk about your functional level. Tell me how far can you walk? Tell me how much you can, go to the grocery store. That's more important to me than if you're a stage 2 or stage 3. So I want to know their functional level. And then once I start recognizing that we have all the right medicines, all the right cocktail of COPD medicines, but we're still struggling with symptoms, that's when my expertise really kicks in. We start thinking about medicines and activities that can help improve symptoms. Then we really start talking more about the goals. And that whole piece is where the palliative care world comes in, right? It's non-hospice, right? But it's the palliative care world where we say, okay, our pulmonary team is doing this slam job that they can with the medicines that we have and the interventions, but that still isn't improving your shortness of breath, right? And it's not because those medicines aren't working anymore. It's because of the progression of the lung disease that the symptoms are still a problem. So I think that we have to be able to shift, and the patients need to understand that we're not saying, well, the pulmonary providers don't have anything else to offer. They always have wonderful things that they can work through, but it may be through folks like me. And I think I referenced Dr. Florence Wald's statement where she says, in some ways, we have to reform our end goals. We need to cure sometimes, but care always.
So, Lisa, I'm curious to get your perspective on your communication between your primary care and, when you go to your pulmonologist.
For my primary care doctor, she does not seem to understand the basics of the whole COPD issue. She doesn't understand that I can be worse in the morning and not in the afternoon. Trying to get them to understand that I don't sleep well at night, and I know by my oximeter that my oxygen is dropping to 86, 87 in the middle of the night. But yet they don't want to seem to do anything about it because when they see me, my oxygen's fine.
So do you think that if you had better communication with your healthcare team, it would impact how you feel and your symptoms at all?
If I had better communication with them, I don't think I would be having so many flare-ups. If they would communicate better or listen to me, I could be on a different medication perhaps, instead of waiting to go see the pulmonologist once a year. Right. Your primary care doctor is your first line of defense, and they need to keep that communication line open in order to get the best care possible.
What advice do you guys have for people out there who are looking to improve communication between them and their healthcare providers?
Listen to your doctors to a point. They got to listen to you, but you also need to listen to them because, I used to say when I was younger, I'm like, oh, whatever. They're just telling me this to scare me. But you know what? They were right. It is a two-way street. It's definitely a two-way street. And, they're really not there to scare you, no matter what we think when we're younger. My number one advice would be to have a list of questions ready. Tell that doctor, go under reputable sites, get that list, or ask people under those reputable sites, say, hey, I was diagnosed with this. What are some good questions to ask my doctor? And tell the doctor, I'm sorry, but here's my list, hand them your list and say, I need to go over these questions before you leave this office.
I want patients to feel empowered. I think the other thing is making sure that the patients have access to really reliable resources when they're studying things. Because I know they come in with, sometimes they bring in like 5 and 6 pages, sometimes 10 pages of things they pulled off the internet that they want to talk about or they want to try. And I appreciate that. I really do. But I find that these things tend to be less evidence-based driven. So it worries me when we start thinking about some of those. If I don't know what the potential outcomes, positive or negative, could be, I really do appreciate what the COPD Foundation has done to pull these tools together. I like when my patients bring in their action plan so that we can review it and repeat, right? Like we need to repeat this every time because the plan today may not be the plan tomorrow. So we need to know what is that going to look like? So I feel like it's important that for the resources they're looking up, let's just make sure that it is solid science, right? That it is not a one-off of this is a case where one person benefited from this. And I'm not saying that won't happen, but when we're trying to make decisions about treatment, we tend to want to have more than just one person benefiting. We like to see that there are other people that have responded to it. I also think that really like for patients to kind of comply with the treatment plan. know that this is what we've laid out. This is through some of the work that's been done over the last 40, 50 years on COPD, and meet us in the middle with that, right? Like if we say, this is what we find to be effective, this would be helpful, the oxygen therapy, nebulizers, maybe even a home ventilator if you're having issues along those lines, that one, that we're explaining that that's the reason why we need to use, but secondly, that the patient says, okay, I'm on board, I understand this, and I will follow your recommendation.
Thank you for joining us today on the COPD Foundation podcast. We hope this discussion has shed light on the crucial role that clear communication plays in managing COPD. A special thank you to Tracy for sharing your expertise, and Lisa for your honest and insightful perspective. Remember, open and clear communication is key to having better outcomes, whether you're a patient or a healthcare provider. If you found today's conversation helpful, be sure to subscribe and share with others who could benefit. For more information about COPD and other chronic lung conditions, visit the COPD Foundation website at www.copdfoundation.org. Thank you for tuning in. Be on the lookout for more episodes where we delve into all things respiratory. Take action today, breathe better tomorrow.
Thank you for tuning in to the COPD Foundation podcast, and remember, whether you're managing a chronic lung condition, providing support to those who are, or just want to learn more about lung health, the COPD Foundation is here to support you. Be sure to subscribe to this podcast and follow us on social media. Take action today, breathe better tomorrow.